The gold standard developed following our receipt of a complaint from relatives of a patient. In response to the complaint, we contacted the Patients Association and agreed with them to deliver a project that would address the issues relating to the quality of care patients were receiving, the experience of the care patients were receiving, and look to improving that. From that was born the gold standard.
So we got together staff, senior managers and patients and families and really looked at what would a gold standard for older people look like. So we developed a charter and then a patient feedback questionnaire, and we started interviewing patients and their families on the wards to gather their feedback.
When I spoke to patients, at first they were a little bit worried about giving me information, but I told them that it was completely confidential, that they didn't have to give their name, that all I wanted was for them to answer questions. And they were really, really good.
The volunteering has been great so far. I've learned quite a few things from the patients. I've also boosted my confidence a little. And this is kind of important to me because in the future I plan to be a nurse. So if I know what to expect now, it will be much easier for me then.
The involvement of our sixth form volunteers was absolutely invaluable. Having that real human touch with young individuals really makes an impact on patients' journey while they're in hospital. We had a decrease in complaints, reduction in pressure ulcers, a reduction in complaints around communication, improved discharges because communication had improved. So a whole number of factors relating to a good patient experience. On the success of the gold standard framework being rolled out, not only just to one winter pressure ward, to the other 2 winter pressure wards, we are planning to roll it out to our other older people's wards at Whipps Cross.
I think the standard has been very good and it's improved services on those wards, and this is a great way forward for patients in the future.
One of our students was looking at pharmacy, and as a result of this experience has changed to nursing, which is fantastic. This really is something that as a college we've really enjoyed, and we'd like to build on it in the future with more students.
You know what works, not just for you, but for patients and for their families.
We had our first nursing conference on the 6th of June this year. We are very encouraged by the fact that all attendees are absolutely keen to roll out the gold standard in their organisations, and we will support them to do that. Waltham Forest CCG want to thank the relatives who brought this complaint to our attention. Because of them, we have this excellent gold standard of care for our patients.